So, awesome question from a VIP patient regarding a slide move and how to start limiting that. Now, we know, especially a lot of data that's come out recently, we know data regarding tour players. We know that a lot of good players are actually utilizing that slide. Now, we need to also keep in mind that individually, context matters. So, a lot of players that we're seeing um, bump their hip out to create a little more speed here at the bottom. They're going to leverage that and they're going to use that to create a little bit of a correction at the very, very end. And that is going to increase a little bit of speed. And their bodies have developed that swing over time. Now, for a lot of our patients, a lot of people that want to golf 1, 2, 3 times a week for the next 30 or 40 years, that's not a great strategy. And the reason why is because, well, especially if they've had low back pain in the past, when we get in this position, now we're losing what we call connection in the ground, right? So now their body isn't as rooted in the ground. The more this hip comes out, because we're unable to access proper internal rotation, now we start to see a loss of power because we're not really rooted. We're not able to shift in and out of our hips and maintain a really good stance. A leg and a body that's stacked up on top of each other, that's going to have the most potential for power. Whereas if we start getting out like this, I can't jump well off this side. So in scenarios like this, everybody knows what do we want to do, right? We want to turn this hip in and move this left back pocket back. Now, the reason why you know that, but you can't access it, if you're watching this on YouTube, you know it, but you can't access it at speed. As soon as you start to create a lot of speed, that slide shows up. It's because you cannot properly access that internal rotation because your left leg doesn't have the ability to shift back in the socket. So we need to create a better shift. We need to create a better move where your body has the range of motion, and it's a lot easier for your left femur to come back in the left socket, which is going to create a nice bit of space here. So those with swing paths that tend to come over the top, those with the slide, as we mentioned, this also applies because the more space we can create here, the more space we have out here instead of having, this is for the early extenders as well, instead of having to come into the ball to get out of the way, we can load that hip properly and we can also turn and move our left glute back. So down the line, what we really want to see, instead of a body that's moving this way, we want to see a turn backwards, and then we want to see this motion first. If we can shift our weight onto our front leg, onto our lead leg, and then turn into that, now we have a ton of space to bring the club down. So now the main thing we're looking for within our golfers in our office is not only do they have the range of motion, because everyone has the right around a range of motion, but can they control it? So the fix for this is being able to give the body a sense of being able to shift that hip back, right? And then from there, being able to control that motion first with motion and then at speed, because then after that, we're going to be able to reciprocate that over and over and over again. Now, I know what you're saying. I don't have back pain, so this doesn't apply. Now, the back pain is going to come from the slide, right? The slide mechanism, and then you having to turn around that. And then depending on what you're doing with this trail leg, we might end up in a scenario where we're just kind of crunching the back down over and over again. You can see this is a very sharp angle. Although your body's meant to side bend, it's not meant to side bend at one segment, right? We need a full lumbar side bend in order to create the right amount of rotation. This is going to limit that because this is going to eliminate that problem because as soon as we shift that hip back, now we have way more space here. This angle here is a lot better, and it's going to allow for more control at the lumbar spine as well. Another reason why you should think about this is because of the performance benefits. Now, you can do this at home. Just standing there, you don't even need a golf club. You can just stand here, you can bump your hip out, right, which everyone's protecting right now because the tour players are doing it. You can bump your hip out and then try to turn through that hip. Right now, I have a ton of tension in my hip. But as soon as I move my hip back, I'm creating all that space. Now I can turn there, and that is going to be it's more effortless for me to get there. It takes a lot less of my force, takes a lot less momentum to get there. And that is what we want within the golf swing, because as we can control and as we can create effortless, efficient motion in rotation at the rotation centers within our body, then we are going to be able to have a swing that we're going to be able to reciprocate over and over and over again. And the swing is going to hold. It's going to hold for the next 10, 20, 30 years. And we're not going to deal with the breakdowns that you see within a golf swing, like low back pain, hip pain, and things like that. I hope this has been interesting, at least to look at, to think about. And Brian, I hope this answers your question.